Welcome back to the channel with me, your host, Dr. Debra Durst, and I have my co-host with me.
Hey guys, Faraday Goli, nurse practitioner here at Revitalize MD, and today we're having another discussion on a very important topic of hair growth.
We get this question so frequently, and both
Yeah.
from men and from women. And so hair thinning is a common complaint, obviously, and it affects our confidence as we head out into the world each day. And sometimes it could be more severe with men. And androgenic hair loss is the most common cause in both men and women. And about 40% of women will start to get hair thinning as we get older. So,
And I don't know about you guys, but I would spend all the dollars to not
yeah,
have bald spots.
yes,
I mean, it's just what it is.
yeah.
I sit down with men and women every single day, and it is a huge concern that they have. And there
Mhm.
are options out there. We don't have to go to Turkey. We don't have to do these crazy surgeries. There are more natural options, and that's what we're going to talk about today.
Yes. And if Turkey isn't in your immediate future, because there are a lot of people on social media talking about that and people heading over there. But, that's still a cost and a cost for a hair transplant if you did it here. So the hair follicle, again, there's a couple different phases it goes through for growth, which is the anagen phase. There's a transition phase where you shed that's weeks long. And then there's a telogen phase, which is the shedding and inactive phase, resting phase of the hair follicle. And that can last for months. And the goal of our treatments is to get you out of a telogen phase or the hair follicle and get into the anagen phase and prolong the anagen phase. That's essentially the goals of almost everything that we do in some way, shape, or form. Or it's increasing blood flow or nutrients to the hair follicle. And so that's the goal, is to get it to grow.
That's it.
Yeah.
And if you're interested in learning more about the science behind that cycle, you can listen to our podcast on the cycles of hair growth,
Yeah.
the science behind it, where we'll kind of deep dive into that, where this is going to focus more on PRF and how it affects hair thinning and
Yeah.
how we can promote that anagen phase and that hair growth cycle, which is where hair wants to live anyways. That's where 80 to 97% of the time, that's the phase that we're in. So it's about prolonging that phase and preventing the shedding phase, which we can lose 50 to 100 hairs a day. So with PRF, or if some of you are more familiar with PRP, it is the process of drawing your blood, spinning it down, taking that platelet-rich plasma, which is first generation. With PRF, we're taking the fibrin, platelet or fibrin, so that we can cause blood clotting, so that we can promote that stem cell, that growth, that cell proliferation, that all of those healthy factors to communicate with stem cells for hair growth.
It's in a nutshell. Done.
That's it. Done.
We're all done. Yeah, that's easy.
Easy.
Simple.
Simple.
It's very simple.
So simple.
Done. Let us know what you want to hear more about. So we're really talking about the fact that, again, the hair follicle is the anagen phase that's usually affected when there's something abnormal going on, and even the hormones. And so getting it back into that phase. But the PRF, again, is the latest. Most people will hear about PRP. There's tons of studies that support PRP for hair growth and for regeneration and lots of other issues. And the main thing is that it releases lots of growth factors. So if we're drawing your blood, we're spinning it down to get platelets. PRP versus PRF, we're just spinning it in a different way, processing it differently, and not putting an anti-coagulant in PRF versus PRP. But platelets are still there, and they have growth factors. And so those growth factors that are released, like a platelet-derived growth factor is one. And so that's communicating with stem cells in the area. A vascular endothelial growth factor. There's just all kinds of different growth factors and cytokines in there, transforming growth factor, that are going to basically communicate with those stem cells to do different things. So proliferate the hair cell.
Yes. So cause cellular division.
Yeah, that proliferation word can be a little long. Yeah, so cellular division, thicker hair follicle when it does grow back. And a lot of people that actually get that hair growth back are also getting darkening, or their original
Say
color.
goodbye to granny hairs.
Yeah, exactly. So that is one thing that happens, is the gray, they tend to come back in as their natural color more than they do for the gray. That's one nice, very straightforward way to say it. Get rid of the granny hairs.
It can also help with blood supply.
Yes. So vascular endothelial growth factors will help with that vascular supply to the area. And even just fibrin and collagen and elastin. So that supportive tissue in the scalp is there to support the hair follicle.
And it helps thickening that dermis as well, that
Mhm.
tissue.
Yeah, and then also immune modulation is one thing that we don't often think about with PRP, but a lot of times there's some immunogenic cause of hair loss, and of the different causes, androgenic is the most common, but there is an alopecia areata that can have an immune response to it where you have patches of hair loss. And so some do think that that PRP or PRF is not going to work, but it actually does. And there are studies to support that, but also there is that immune modulation that helps with that kind of
It will
loss.
support it.
Yeah.
Yeah.
And so our core is PRF injections. And again, PRF being the second generation. And that's kind of with this, instead of, we do supplements and topicals, and we have other videos that we will post. So you should subscribe so you get notifications, because there's some ingredients in some of our topicals that people don't even think about for hair loss. And then there's great supplements too. So,
And some of those ingredients have some pretty crazy statistics that you wouldn't think of. They would.
yeah,
It's surprising.
yeah,
So definitely listen to our episode on that to learn more about it. But
Yeah.
as Dr. Durst said, PRF is our core, so it is an injectable. So you're coming in, we're spinning the blood, we're drawing your blood, spinning it down, and then we are re-injecting back into the scalp. That is, like Dr. Durst said, our basis. So from there, we kind of build off of that. We do have some patients that come in and just do injectables, but really to get your best results, it needs to be a little bit more comprehensive, meaning we look at those topicals, we look at the supplements, we add lasers to that treatment if needed, and then looking at blood work
Mhm.
and seeing what can possibly be affected there as well, so that we can attack it from all sides.
All the hormone evaluation, including thyroid, just to see. And then again, if you are on hormones, a lot of people come to us with hormones and a side effect of hair thinning and have never heard of spironolactone even. And so there are ways when you specialize in hormones that you can actually not only prevent, but adjust and treat and add some things if somebody would tend to have some kind of side effect. But you don't have to necessarily have a conversion. So testosterone, if somebody's on that for a hormone replacement, whether it be a man or a woman, can convert to DHT, which is 10 times stronger. So it can get you feeling better, but potentially have the side effects of hair loss, acne, hair changes, I should say. And so hair thinning would be an unacceptable one, but there are things we can do to adjust that. But even if it isn't high, and we always do baseline levels and would check if somebody had issues, and we really run into something we can't adjust, but you can always do things, but it also can just concentrate in the hair follicle. So DHT doesn't necessarily have to be high. It can also just concentrate in the hair follicle and cause some hair thinning if somebody is sensitive to it. And that's often what happens in the androgenic hair loss patient. So,
And that's why those topicals are so great.
mhm.
You don't have to take something orally, systemically, where you can just do something that concentrates right at the site to help clean that DHT out of the follicle.
Yes. What I wouldn't recommend is that you just go and start treating yourself and go down the Google, Dr. Google pathway, where you just start to use, for instance, Propecia, which is going to be a 5-alpha reductase, which inhibits the enzyme that converts to DHT. So people will read enough to know that that conversion can cause some hair thinning. Let me take, Propecia. If you're going to take that, that should be a topical thing and let it concentrate in the hair follicle directly. But if you take it orally and you're not on hormones, you can have some erection issues. So it's best to see a physician or get an office that specializes in looking at a hormonal picture and can treat hair thinning. That would be the appropriate approach, right?
Absolutely.
So that is PRF and PRP. There's lots of studies to support it. We do it. That's our core treatment. And then we always add to the top of that. And we've kind of played along with almost everything.
Yeah.
We played along with numbing, what works better, blocks, topical, just some freezing or the Zimmer. And honestly, right now, I think our best pain control is like a Pronox or a laughing gas, and the freezing, like the Zimmer, where we just follow the injections.
Yep, where we're
And
cooling
then,
at the surface.
and then you can also do a stamping of the scalp with a microneedling device after. That helps increase inflammation, helps create those microchannels. And then we always put a topical on that has stem cell growth factors, cytokines in it that help. So those are things that's just with our injectable treatment. And so again, but what Faraday was saying is we'll hit it from other angles as well. So stay tuned, because we are going to talk about those other ways to treat it with supplements that you can take at home, and the number one selling one. So subscribe so you can get those notifications, and then also topicals with ingredients you haven't even thought about. So let us know if you want to hear anything else, because again, we're willing to deep dive into anything aesthetics or wellness. And thank you for listening.